COVID has affected our business basically just in people making appointments. At first, I think people weren't quite as fearful of it, so we were staying pretty steady. It slowed down a little bit, and we did lay our staff off for a month through March. And only 2 of us employees, plus the 2 doctors, saw emergencies and took care of patients. But since then, a lot of people have been scheduling. A lot of our older patients, surprisingly enough, have not been as fearful and have wanted to get their eyes checked and stay following up on the health care of their eyes. The first month we really started back in April and May. We ran a limited staff, so we split our team into 5 team members per doctor, and they worked 2 days a week, and then the other staff came in and worked 2 days a week. Safety measures for patients are when they come through the door, we've told them to wear a mask. We take their name, their contact information, as well as the reason they're in today, whether it's just to pick up glasses or look at glasses or for an exam, and we take their temperature. So that way we have a good trackable source in case one of our employees were to get sick, we could pass that information on to those people that had been in contact with them. Like I said, at first it was we closed down for the month of March, or the April, I guess it was, is when we closed down. And then we came back limited, but now we're back to our hours are Monday through Wednesday, 8 to 5, Thursday 9 to 5, and Friday 9 to 1. So now we're back to normal operations. Basically, we're constantly working that, and we're looking at everything from a week-to-week basis. So yes, our staff knows that if, for say some reason, one of our staff members calls in sick, they have to be 24 hours, and then if it's over 24 hours, if it wasn't just a headache or something, then we're asking them to be tested before they come back to work and quarantining. And then, of course, if one of them were sick, we would all quarantine at that same time. So we've basically done a step-by-step protocol of how we'll handle things. And as you know, everything is so iffy and always up in the air. So sometimes those plans, best laid plans, can be switched at a moment's notice. So we just have to be prepared as a team to stay in communication with one another. You know, I think the biggest thing is, obviously with the mask on, we've lost the human connection as far as the smiles and eye contact. And so my suggestion is just to remember that everybody is going at a different phase of this COVID-19 in their emotions. And so is trying to treat each person as an individual and not lump everybody into one group. And remember the customers come first and that they're still people. And we still have a service to give. And COVID, as much as it's out there, we can't forget to live. We have to remember that we have to take care of people, and people ultimately come first. And there are issues that were going on before COVID. We need to address them and still take care of them so they can still have quality of life. I just hope our community stays safe, that we keep a smile on our face, that we know that through this, everybody working towards keeping together as a community, I guess, and remembering to keep things local. Together we're going to get through this.